Hi all, I am Dr. Chaitra SK, your fertility specialist. Let's understand the procedure of IVF. I am sure you might have all heard about the procedure of IVF, which involves extraction of eggs fusing with sperms, making the embryos grow in an IVF lab and then getting it transferred inside the female partner's womb, which can result in pregnancy. But is the procedure of IVF as simple as it sounds? So let's understand the procedure of IVF step by step. To begin with, IVF starts with a priming phase or a premedication phase. Then comes the controlled ovarian stimulation, an egg retrieval phase, fertilization and embryo culture phase, which happens in the IVF lab, fresh or frozen embryo transfer, and the last step is the implantation process and then the pregnancy result. So to begin with, this IVF procedure happens over a period of 1 menstrual cycle if you are undergoing a fresh embryo transfer. In case if you are not a suitable candidate for a fresh embryo transfer, your fertility specialist might decide to freeze the embryos and transfer it in a subsequent menstrual cycle, and hence in case of a frozen embryo transfer cycle, your total IVF procedure happens over a period of 1 to 3 menstrual cycles. So let's start with the priming phase or a pre-medication phase. The female partner will be called on 2nd or 3rd day of her menstrual cycle. A transvaginal ultrasound will be done to see her egg count and for the presence of any ovarian cysts. Some hormonal assay will also be done on this day. So based on the test results of your hormones and also the transvaginal scan, your fertility specialist may decide to put you on some hormonal medications, be it birth control pills or estrogen or progesterone supplementation. This helps to reduce any ovarian cysts and also to improve the cohort of the follicles. You may also be put on folic acid, vitamin D and some antioxidants in an attempt to improve the quality of your eggs. In case if you are having less reserve or a low egg number, then the fertility specialist may also put you on some hormones called DHEA or testosterone gel in an attempt to increase the number of eggs. Meanwhile, your male partner will also be put on some stimulatory medications or antioxidants depending upon the semen parameters. The second step in the IVF procedure is the controlled ovarian stimulation. So you will be called on 2nd or 3rd day of your menstrual cycle, and after your scan reports and hormonal assay reports are available, the fertility specialist prescribes you on some hormonal injections which will be given for about 10 to 12 days. Some women may take 1 or 2 extra days of stimulation, and this depends upon the response to ovarian stimulation. So the injections which are administered are temperature sensitive, and hence you will be called to hospital to administer these injections in a timely manner. The response to these injections will be assessed through a transvaginal ultrasound which will be performed every 2nd or 3rd day, and also some blood tests called estrogen levels will be done in order to assess your response to ovarian stimulation. Once your follicles are reaching about 17 to 18 millimeter size, you will be administered a trigger shot, and then subsequently your egg extraction procedure will be planned. The third step in the IVF procedure is the egg retrieval procedure, also called as oocyte retrieval. About 34 to 35 hours after administering the trigger shot, you will be called for this egg retrieval procedure, which will be done under anesthesia, that is a simple intravenous sedation. Under transvaginal ultrasound guidance, your follicles will be aspirated by pricking your ovaries. The follicular fluid which is collected will have the presence of your eggs, which will be separated by your embryologist. Post egg retrieval procedure, you will be observed for about 3 to 4 hours in the hospital and discharged under antibiotic and analgesic cover. Meanwhile, the fourth step of IVF procedure, that is the fertilization and the embryo culture, begins in the IVF lab. Your male partner will give the semen which will be processed and the sperms will be selected for the IVF procedure. The mode of fertilization, whether it is an IVF or an ICSI, that is whether it's an ICSI procedure, will be pre-decided by your clinician and embryologist. So the eggs which are collected are injected with the sperms and they are get fertilized overnight in the IVF lab. The next day the fertilization will be checked and the patient will be given an update about the fertilization process. So after this, the embryos are allowed to grow inside the IVF lab's incubator for about 3 to 5 days depending upon the institutional protocols. So once a day 3 embryo or a day 5, also called as blastocyst, is formed, it will be decided whether to undergo a fresh embryo transfer or to do the freezing of these embryos depending upon the condition of the female partner. The next step in the IVF procedure is the embryo transfer phase, which is the most crucial phase of IVF procedure because you are one step away from becoming pregnant. Now this could be a fresh embryo transfer where about 3 to 5 days after your egg retrieval, the embryos will be transferred back to inside your womb. Or it could be a frozen embryo transfer where post your egg retrieval you will have a break of 1 to 2 menstrual cycles and then the embryo transfer will be planned. Now if it is a fresh embryo transfer, after about 3 to 5 days of your egg retrieval, the formed embryos, be it a day 3 embryo or a blastocyst, will be transferred inside you and some hormonal medications, that is the progesterone support, will be given so that pregnancy can be achieved. So if you are undergoing a frozen embryo transfer, you will be called on 2nd or 3rd day of your menstrual cycle and you will be administered a hormone called oral estrogen preparations, which allows you to develop a good endometrial thickness. Once the endometrial thickness reaches about 8 to 9 millimeter, you will be planned an embryo transfer after about 4 to 6 days of progesterone administration, depending upon whether you have been planned a day 3 or a day 5 embryo transfer. Once the embryos are transferred inside you, you will be administered luteal phase support in the form of estrogen, progesterone, HCG and other supplements which will help in the implantation process. After about 14 to 16 days of embryo transfer, you will be called for a pregnancy test where you will be doing beta HCG test to confirm your pregnancy. The whole procedure of IVF can be emotionally, financially and physically very demanding. Hence, it's important that you mentally prepare for the procedure of IVF and take a thorough counseling with the help of your fertility specialist and IVF counselor in order to understand better about the steps involved in the procedure of IVF.